And we're continuing coverage on the inauguration as well as the coronavirus. And so right now we have Quick Takes Madison Mills with us, who is here to talk the latest on the coronavirus. Madison, thank you for being here. And tell us, what were your biggest takeaways? Today, President-elect Joe Biden had a press conference. What was the biggest takeaway?
Right, Renita. So Biden unveiled a five-step plan about the COVID vaccine rollout earlier today. I want to play a quick soundbite from President-elect Joe Biden from right before he announced his five-step plan for the coronavirus vaccine rollout.
100 million shots by the end of our first 100 days in office. Some wonder if we're reaching too far for that goal. Is it achievable? It's a legitimate question to ask. Let me be clear. I'm convinced we can get it done. And this is a time to set big goals, to pursue them with courage and conviction, because the health of the nation is literally at stake.
So President-elect Joe Biden unveiled this new five-step plan that was lauded by his officials earlier this week. But I do want to point out that the plan was more of a revision of the steps we've already heard from the Trump administration rather than a full rewrite. There weren't a lot of new changes that we're hearing about today, but I do want to dig into a couple of the announcements here. We heard from Biden, again, what we've heard from the Trump administration about increased eligibility. He talked about making sure that states weren't being too rigid with that vaccine line. He just wants these shots in people's arms. He also talked about the importance of getting federally backed vaccination sites. And then he also talked about two things that I did find to be interesting and a little bit new. He talked about a public education program for making sure that people are informed about this vaccine, which is something the Trump administration has really not followed up on throughout this pandemic and is really important for getting to that herd immunity, getting enough people vaccinated to make sure that we can all move past this pandemic. He talked about reaching out to communities of color, reaching them where they are in community centers and getting them vaccinated. And he also talked about making sure that states know exactly how many shots they're going to get every week so that they can plan. And this is something we talk about a lot, right? States have no idea how many shots they're going to get each week, so they're not able to essentially pre-book people to come in and get the vaccine. And Biden wants to address that by making that really clear for state and local officials.
Right. He did lay out quite a few different angles to his plan today. And so he also tapped former FDA Chief David Kessler to become his first Chief Scientific Officer of COVID response. So how could Dr. Kessler affect the administration's vaccination plans?
Right, so Dr. Kessler has a lot of experience in this type of role. He's already led several health agencies here in the U.S. under previous administrations. He was also a key figure in speeding up the approval of drugs that really changed the course of the AIDS epidemic here in the U.S. So he's already had a very relevant experience in a situation where he also had to push forward a cure very quickly for something in the U.S., right? Also, he's very close with Dr. Fauci. The two worked together closely during the handling of the AIDS epidemic in the U.S. And lastly, he's worked with Biden as well. The two have had 50 to 60 briefings with one another on COVID, so they already have a pre-existing relationship heading into the Biden administration.
Now, states are still struggling to get out vaccines quicker. Talk to us about vaccine developments with states.
Right, so we are hearing that states are continuing to have challenges getting the vaccine rolled out as quickly as they're being asked to. And this is something that, again, the Trump administration earlier this week announced that they have new guidelines, right? They want to make people over 65 eligible and people who have pre-existing conditions eligible. So that's opening up the vaccine to over 128 million new people. So the question is, how are those people going to get shots, right? Well, the Trump administration originally said that they had a stockpile of vaccines that they could give these people for their second doses, and they ended up not having that. The Washington Post came out with a report saying that the Trump administration had already given out this stockpile. So state officials are already being affected by this. Governor Andrew Cuomo talked about this earlier today, and here's what he had to say about that.
Not only did we not get more supply, we actually got less this week. We went from 300,000 dosages down to 250,000 dosages. So the eligibility opens up, the supply actually comes down.
So this is a big concern for states, right? Because people think that they're eligible for the vaccine and they're showing up to vaccine sites, but they're not able to get the shots.
Now, Maddie, on a lighter note, there's a big name change coming. What's happening with Operation Warp Speed?
So a Biden official did announce today that the name Operation Warp Speed is going to be retired when Biden enters the White House. And it's something that, you know, we joke about a little bit, but it's actually a really important thing, right? Because branding this effort, Operation Warp Speed, kind of gives a connotation that the vaccination effort has been pushed through too quickly. And that could, again, be a hindrance to that public trust building that's really important for getting people on board to take these shots.
Let the rebranding begin. Thank you very much, Maddie Mills.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.